Good morning, everyone. I'm Dr. Susan Marra, and this is Dr. Marra's Medical Minutes. And today we're going to talk about the importance of maintaining vitamins, minerals, and electrolytes during treatment. I mean, for obvious reasons, you need vitamins. You get vitamins from food. You get it from things that you drink. Um, you know, you need it. You need it to keep your cells working properly. Um, as well as minerals and even trace minerals. And the reason is that when your body is significantly stressed in the way that it is when you have chronic infection, you have a release of something called reactive oxygen species. And they are free radicals that can wreak havoc in the body. And they disrupt normal metabolism. Okay. And they do it by lots of different mechanisms, but they oftentimes will deplete minerals. So what are minerals? Things like copper, selenium, magnesium, calcium. These are nutrients that are vital to your proper functioning and to the ability of your ability to fight infections and properly detox throughout the process. So, maintaining proper amounts of minerals is a really big deal. And you can do that by taking a capsule, or you can do that by taking a capsule or a liquid. And the liquid is usually called I think it's called Trace Minerals. I think you can get it on Amazon. And I alternate between the two. The other thing that I do is I drink coconut water. Okay? You can get it. It's really cheap at Trader Joe's. It's called Zico, Zico. And I drink that throughout the day in place of water because it has a lot of electrolytes. And electrolytes are things like potassium and sodium, which are vital to maintain cellular health. You have to have a proper balance of sodium and potassium, okay, especially in the brain. Axon potentials, which is the way in which electrical energy gets transmitted in the brain from neuron to neuron, requires a balance of sodium and potassium. So it's really pretty critical that you take electrolytes. I prefer coconut water, but the other ones that are good is IV hydration and LMNT, which you can get on Amazon as well. That's a powder. You just mix it in with your water, and it tastes good, and it will boost your electrolytes. So vitamins, minerals, and electrolytes are absolutely essential when you go through Lyme disease treatment, especially if you have a reduced appetite. Oftentimes, just the illness itself makes you feel terrible. And then add antibiotics or herbs on top of that, and you have very little appetite for anything. And so your body is nutrient deprived and nutrient starved. That is not a situation in which healing will maximally take place. So you want to get a good multivitamin. Some people need B vitamins, like heavy duty B vitamins. Minerals, and that can be trace minerals, which is in a liquid, and electrolytes, which is IV hydration or LMNT or coconut water. So I hope that you found this information helpful, and I hope you have a wonderful day. Thank you.